Hey guys, my name is Vishal Saini and I'm a third year MBBS student in a government medical college. Today in this video I'll be dealing about a very interesting disease, heart attacks. Heart attacks also called as myocardial infarctions. Okay, so what is an heart attack? You all know what is an heart attack. A heart attack is usually a block in your heart vessels that leads to decreased blood reaching to your heart muscles and the heart muscles dies. That is heart attack. This video mainly deals about the treatment options you can give to an heart attack patients. Okay, and patients of heart attacks, I'm telling you, please don't skip your treatments. Okay, it's very necessary for you to have those treatments. It's very necessary because these things takes time to manifest. Please don't skip your treatments. I'm telling you now. Okay, if any heart patients is listening to this video, please, I'm telling you. So what are the treatment options you can give to a heart patients? Okay, for students, please learn this treatment options. Okay, first, there is a clot in your vessels, so you have to prevent further clot formation. Okay, so you have to give them blood thinners. In blood thinners you can give them what? Aspirins you can give them, or clopidogrel you can give them, or heparin you can give them. Either one of them is fine. Aspirin you can give, or clopidogrel you can give, or heparin you can give. Okay, so doctors usually give them aspirins. Okay, second, what are the second things? When a heart attack patients came to you, he usually presents with what symptoms? Like chest pain, na? So there is a chest pain, congestion in the chest. Okay, and this pain is radiating to what? The left shoulders, medial side of the hand. Okay, the pain is radiating toward it, means it's a classic sign of what? Myocardial infarctions. You get an ECG done, and in ECG if you see an ST segment elevation or ST segment depressions, means there is an subendocardial ischemia or transmural ischemia. Okay, so what you'll give them to reduce that angina? Okay, to reduce the exertion on the heart, what you can give them? You can give them beta blockers. Okay, or nitroglycerins. Nitroglycerin is usually short acting, so usually doctors recommend beta blockers. Okay, third, what you can give? If a clot is there, you have to revascularize the patient. Means what? After giving all these medications, means blood thinners, beta blockers, okay, the first two which I've discussed now, after giving all these medicines, still the patient is not recovering, still the patient has chest pain, means the clot is too much big. You have to revascularize the patient. What does revascularization means you have to maintain the integrity of the vessel in which clot is present. And how you can maintain it? You can maintain it by giving what? PCI. You know what is PCI? PCI is less like percutaneous interventions, in layman terms, which is like, call it stent. We put a stent in the vessels so that we open the vessels and so that the blood can go easily to the heart. Okay, that is PCI. Third, revascularization of the patient, PCI, or cabbage. We can do cabbage also. What is cabbage? It's not like an eating cabbage. Okay, cabbage is coronary artery bypass graft, CABG. Okay, you can do that also. You can do cabbage or stent, but usually stent is preferable. Cabbage is done in different conditions. Okay, and fourth, what you can do? If you have put a stent, okay, so what if the stent get clot? If there is an increased production of clot inside the stent, you don't want the clot to form on the stent now, so you have to give them what? You have to give them dual antiplatelet therapy, DAPT, dual antiplatelet therapy for 1 year, at least 1 year. Remember, at least 1 year for you. You have to give them dual antiplatelet therapy. First, blood thinner, you give them aspirin. So along with aspirin, you can give them ticagrelor. Okay, for 1 year, aspirin plus ticagrelor for 1 year. Okay, dual antiplatelet therapy for 1 year, because you don't want the clot, you don't want the stent to get clotted. Okay, more. Fifth option, you can give them what? Fifth option, you can give them statins. Statins do, it decreases the cholesterol of your body. Okay, so yeah, it prevent further clot formation. So yeah, there are generally major type 5 treatments you can give them. First, what is the treatment? फर्स्ट इज एस्पिरिन दे दो. ओके, क्लोपिडोग्रेल दे सकते हो या हेपारिन दे दो, तीनों में से कोई एक देना है. ओके, सेकंड, यू कैन गिव देम बीटा ब्लॉकर्स और नाइट्रोग्लिसरिन्स. ओके, थर्ड, रिवैस्कुलराइजेशन कर दो पेशेंट का कि प्रोवाइडिंग दैम पीसीआई मीन्स परक्यूटेनियस इंटरवेंशंस, और स्टेंट भी बोलते हैं इसे, और डू अ कैबेज. दोनों को डिफरेंट कंडीशंस में करते हैं. ओके, कैबेज मीन्स कोरोनरी आर्टरी बाईपास ग्राफ्ट. ओके, फोर्थ थिंग व्हाट यू कैन डू, in that clot, you don't want, in that stent you don't want a clot formation. Okay, so you have to prevent the clot formation. You give them, after putting a stent, you give the patient dual antiplatelet therapy for 1 year, at least 1 year. Remember that 1 year. That's why the myocardial infarction और heart attack patients को medicines 1 साल तक लेनी पड़ती है. That's why they're fed up from the medicines, or that's why they don't take the treatment. Or fifth one, or you can give them statins, okay, that decreases the cholesterol of the body. So these are the treatment options you can give them myocardial infarction patient.